And welcome back to Western New York Living. For those of you who have never suffered from varicose veins, you cannot understand the pain and aching the disease causes in someone's legs. At Windsong Radiology, they can now treat varicose veins with minimally invasive, more cost-effective treatments than in the past. Let's head over there now so you can find out more about their life-changing treatments.
For most people, when you mention varicose veins, the first image that comes to mind is twisted, bulging veins in somebody's leg. While this is often true, the signs and symptoms for some people can simply be heaviness, swelling, or even fatigue in their legs.
After a long run or a race, I will have throbbing on the inside of my calves. It'll prevent me from actually wanting to move.
I met up with Dr. Dana Dunleavy recently at Windsong Radiology Group to talk to him about chronic venous insufficiency, some of the latest minimally invasive treatment options they offer, and signs someone may be suffering from this problem.
The easiest thing for most people is the bulging varicose veins. The other things that some people don't realize is they'll start to notice like a tan on their calves or legs in the shin area, start noticing some freckling or a little goldish color. And that, obviously we're in Buffalo, and it's cold, and it's not related to the sun. And that is related to damage to the skin from the blood pooling, not draining appropriately. So that is definitely a sign to get assessed quickly. You don't want to wait for the sake of waiting, because as that backs up, it damages more veins. And so over time, you may need more veins treated later than you would have if it was treated up front. But not everyone can be treated with the same technique. And so whether it's radiofrequency ablation, or it's sclerotherapy, or it's phlebectomy, we use all different types of techniques depending on what the patient presents with and what is right for them.
At Windsong Radiology, they not only treat the spider veins, they more importantly treat what causes them. This, in turn, allows their patients to return to a pain-free lifestyle they once enjoyed. The procedure starts with a thorough exam and evaluation.
What we do is we do an ultrasound. It's a very careful, thorough ultrasound, so it takes some time. And we let people know to be patient because we map out all of the veins and we identify how well those valves are functioning. We also can map out exactly who is connecting to who. So we're not actually treating the varicose veins to start with. We're treating what caused those, because those are just a product of abnormal valves. But the byproduct of that is that the varicose veins also improve. We can do things directly to the varicose veins, but our first goal is to fix the problem that caused those.
Windsong Radiology caters specific treatments for each patient, one of which may be an ablation treatment, which takes about 30 minutes and is far less invasive than vein stripping and much more effective.
Instead of making multiple incisions, going to a hospital, operating room, anesthesia, and that recovery, you can just numb the skin, put a catheter into the vein. People can't feel the fact that the vein can take the catheter for quite some distance, and you can treat a whole length of vein just from a tiny little skin incision. So immediately after the procedure, you can go back to normal activities. We do encourage people not to do strenuous activity for 1 to 2 weeks. Heavy lifting basically is to be avoided because that can dilate the veins, but they can go right back to work immediately. A vein should only need to be treated once. So once that vein is treated, that should be lifelong. Sometimes people, because they have abnormal veins, will develop new veins later in life, but it should last forever. And a lot of the treatments we're doing aren't matters of life or death, but they do change people's lives. And when you take pain away, it's amazing. It improves so many other aspects of their life as well.
See, help is on the way. If you suffer from varicose veins, I suggest you give Dr. Dunleavy and his staff a call at Windsong Radiology Group. Their number is 929-9484. Their main offices are located at 55 Spindrift Drive in Williamsville. Remember, Dr. Dunleavy specializes in interventional services such as chronic venous insufficiency, and the treatments they perform are minimally invasive with very little downtime for the patient. To find out more about all the services Windsong Radiology offers, check them out on the web at windsongradiology.com.